My name is Akhilesh Pathipati. I'm a third-year Stanford medical student.
Thank you for coming. I was really interested in your poster. I'm interested in telemedicine in general. Tell us about it.
So the project is looking at the implementation and evaluation of a direct care teledermatology service at Stanford. So when you think about teledermatology, it's a pretty common and pretty well-established field within telemedicine. Obviously, dermatology is well-suited with a lot of superficial lesions. But there are multiple models within teledermatology. So the most commonly studied one is a consultative model. So a patient goes to a provider, often their PCP, and then if there's a skin issue, the PCP can serve as a referring provider and connect them to a dermatologist. So that's something that's been very well validated in studies, something that has had a lot of success in helping taking care of patients' dermatologic issues. Something that has become more popular in the last few years is direct-to-consumer teledermatology or direct care teledermatology. And in this model, you essentially take out the referring provider. So the patient connects directly with a specialist. And it's something that is becoming more common, as I mentioned. There's a study published earlier this year that found that there are now more than 20 direct care teledermatology services available to patients.
Just in the U.S.?
In the U.S. alone, dozens overall, offered all over the country. Patients like the convenience of it, but these models are not very well studied. They haven't really been implemented in academic settings. So at Stanford, the Department of Dermatology and Stanford Healthcare decided to implement a direct care teledermatology service and see how it's working. Exactly. And then, while doing it, why not study it? Because we want to make sure it works. People seem to like it, but we don't know what they're getting out of it. So we started the service, made it available to people who had Stanford Health Alliance health plans.
And just to clarify, these are people who are mostly Stanford employees?
Yeah, primarily Stanford employees. Yeah. And so they had the opportunity to connect directly with a dermatologist using their My Health online portals. And so over the course of a pilot period, we had 38 patients take advantage of the service over the course of about 6 months. Not a huge volume, but what we would expect for a pilot period. And of those 38 patients, we started looking at whether they were getting what they wanted from the dermatology service. So 38 patients, a dermatologist was able to make a diagnosis for 36 of them. So a high level of being able to come to a diagnosis. And we also asked the dermatologist to rate their confidence in the diagnosis. And the average level of confidence was a 7.9 out of 10. So they're pretty confident that they were getting the right diagnosis. And about a little under a quarter of the cases, we did ask patients to come in for a follow-up visit. That was primarily because we wanted them to come in for a therapeutic intervention. So, for example, a biopsy of some sort, or something that just needed follow-up from the initial encounter. We also tracked how long it took for the patients to get their initial diagnosis. With independent services, on average, they take about 48 hours. In our case, it was less than 24, so patients will get a response in under 1 day. So, in thinking about the project, we feel like the pilot project was successful. The dermatologist was able to make a diagnosis. Patients reported that they were very happy with the service, very happy with the convenience. So we felt like it was a successful pilot. With that said, I think there are a few caveats to bear in mind when thinking about a direct-to-consumer telemedicine service. So in this case, it worked very well because patients were interacting with a dermatologist that was already within their health system. So the dermatologist had access to their pre-existing health records, to their history. They could follow up with the PCP if they wanted to. With a lot of the independent services that are offered, that isn't available. It's a one-off encounter. And so we think that it's worth trying to learn more about outcomes in those services. But at least in this model, we think that it was successful.
Did you categorize the nature of the questions that the patients were seeking answers for? Acute versus chronic, inflammatory versus static?
Yeah, as part of the encounter, we did tell patients if they felt like it was something emergent or particularly acute that they should stop using this and go in to see an actual doctor, go to the ED if it is an actual emergency. So we were explicitly trying to avoid interacting with emergencies on this. With regards to the nature of the problem, they tended to be things that are common issues in dermatology. So a lot of rashes of different types, a lot of issues with acne, a lot of people who wanted some sort of follow-up or treatment regarding acne control or a chronic dermatologic condition.
A second opinion for therapy?
Yeah, a second opinion for therapy, or once they already had received some sort of consultation or encounter, just they wanted a tweak to their treatment plan, something like that.
Oh, there was one other aspect of your poster, which is about the cost of that to the patient.
We did not charge patients for this service in the pilot period, but we did ask them what they would be willing to pay for the service, because at some point, people do want to get paid for the work that they're doing. And we found that patients were essentially universally willing to pay something for the service. It did offer them a lot of convenience. But they did feel like they should be paying less than for an in-person encounter. Most commonly, people were willing to pay in the $20 to $60 range for this service.
And what about the duration of the time needed for the dermatologist to come to a conclusion and offer that?
Yeah, so in the pilot period, it was very quick. So less than 1 day from the time the encounter was submitted to the time the dermatologist first responded.
So when the dermatologist got the consultation, did you look at how long it took him to do it?
We did not look at that.
Because with regards to the cost and the value of it, I
Right.
would think that would be an important parameter to look at. It would be
Right.
very efficient for the dermatologist.
It is certainly a faster encounter, given that they're looking at a picture and coming to conclusion, and a lot of the information that they're looking for in terms of history, instead of chatting with the patient there in print. There was a list of questions that patients filled out as part of the encounter.
So you had a standardized encounter.
Yeah, a standardized form. So patients went through, answered a series of questions, included a picture if that was relevant, and then submitted.
And people felt like that was enough information for them to do the consultation.
Yes, one of the pieces of feedback we got was that patients did feel pretty comfortable with the service. They felt like it was very user-friendly, but if they were to change anything, they would appreciate a little bit more guidance in terms of navigating the process. And that's another thing that we thought was an interesting finding, because with a lot of independent services, you don't get to provide that feedback, but we felt like that was useful for us to know. And try to isolate what it is that people think would be most helpful in terms of guiding them through the encounter.
So what do you think is the future of direct-to-patient teledermatology?
I think it's going to grow, just because patients do seem to really like it, and they do seem to really like the convenience. If it's going to grow, I think the question then is, how do you best optimize teledermatology services? I don't think the consultative model is going away. I think people do have a good relationship with their PCP. It's good for the PCP to be involved and being a referring provider when the patient is in need of care. But I think if patients are going to seek out these direct-to-specialist services, it's good for that to be incorporated into the patients, to their medical home.